it's your freedom. When someone pays you and comes into your office, they come in voluntarily, you're earning an income, it's yours. But you give up some of it, some of your labor and some of your freedom to have government. But it's an argument because it is your labor and your freedom why you want to minimize what you give up. You want the minimal amount of government that we need. We don't want the maximum, we want the minimum. There's another argument for why you want to minimize government. This comes from Milton Friedman. And this I call the efficiency argument for minimizing government. What Milton Friedman said was that nobody spends somebody else's money as wisely as they spend their own. So in your businesses, you may have 3 employees, you may have 20 employees, but you watch your expenses. Every month you've got to meet a payroll and you got to have some left over for yourself. You try to maximize your profit. That's your job. If you have shareholders in a publicly held corporation, you try to maximize your profit. But you look at it every month, so you're looking at it, you feel deeply the cost. When you take out a loan, making your payments, you feel all those things. But you ask a politician, doesn't make the difference whether it's $100, $1 million, $1 billion, or $1 trillion. They don't feel it in here, they don't make wise decisions because it's not their money. So you should minimize how much money you send to Washington. If you have to have government, it's better to have it at the state level. If you have to have government, it's better to have it at the local level, where you have more responsive government and you can watch over what goes on. What's gone on since we've made government so distant, we've sent so much of the authority to Washington? $1 trillion annual deficit. We're borrowing $30,000 a second. And so the government says, well, we've got to take over health care. Well, we already had the government involved in over 50% of health care through Medicare and Medicaid. And they were short of money, perpetually short of money. Medicare is $35 to $40 trillion short. So what did we do? We said, well, 15% of the people are uninsured, let's get them insurance. And it won't cost anything, it'll reduce the deficit. And I say, yeah, and I've got some swampland I'll sell you in Florida. We're going to add a new program and insure 15% of the country and it's not going to cost anything? Well, sure, it's going to cost something. So what did? We took the money and borrowed it from Medicare, which was already $35 to $40 trillion short. And you say, well, Medicare should be paid for. We all pay Medicare taxes. For every dollar in taxes you pay, you will take out a little over $3 in benefits. That's what's going on now. You combine that with the fact that a whole bunch of people were born and they're all retiring. A bunch of people were born after World War II. I say, look, it's not Republicans' fault that Medicare is broken and Social Security is broken. It's not Democrats' fault either. It's your grandparents' fault for having too many damn kids. But it happened. We had this huge population explosion from after World War II all the way up to the early 1960s. My wife hates it because I think we're in the sort of the last year of the baby boomers, and she's like, we're not baby boomers, we're not those old people. But we're right at the tail end of it. But a huge amount of people were born and they're all retiring. But we're also living longer. So we've got people living, when Social Security started, the average life expectancy was about 65. What a great plan. You don't have to pay any Social Security because they die. But now everybody lives another 15, 20 years beyond that, and the programs just don't work. So they have to be fixed. But what does all this mean to you? When you want anything, any kind of parity with everybody on Medicaid or Medicare or anything else, there's no money. And so what people say to you and what happens to the program, whether it's from the ophthalmology crowd or optometry crowd, there's no money. And so they say, well, more people are going to have Medicaid. When they come into you, they'll have Medicaid. Yeah, but more people have Medicaid, but then they're going to have to pay you less per patient because there's not enough money. And they say, well, it's going to be free. The federal government's going to take care of it. Well, they are for a year or two, and then the bills are going to come back to your state capitals. And when the Medicaid expansion comes back, in our state, we're going from 700,000 to another 400,000. So we have a 50% increase in Medicaid. It's going to happen in 1 year, but it's free because Washington's going to pay for it. Nothing's free. There is no free lunch. We have a printing press up here, but there are ramifications to printing up new money. Higher prices. So precisely the people you're trying to help, the poor, the underprivileged, they're going to pay more for their gas and more for their food and struggle even more. But the real problem that's going to happen is there's continual downward pressure on what you get paid. So it could be that, yeah, everybody's going to have insurance, but now you're going to get $3 if you're a radiologist to see an x-ray. The price is going to keep pushing down, down, down. And so we have to figure out how to get a better system that works for everybody. I proposed a couple of solutions. I proposed one solution for Medicare, and this would get rid of the SGR that you're aware of also. The SGR is the downward pressure, the sustained growth formula that puts downward pressure on your reimbursements. I propose that what we do with Medicare is just make Medicare part of the Federal Employee Health Plan. The Federal Employee Health Plan, which is what your congressmen have, your senators have, is just a group of private plans. There's 250 private plans. There would be no more setting of fees. And so really then you'd have competition. So instead of every ophthalmologist and every optometrist getting the exact same fee for an exam, there would be no fee set. People would have all different insurance plans. It would still be subsidized by the government, and they'd choose which insurance plan they buy, but no fees would be set. The good part from your point of view is they wouldn't set your fees below your cost. The other good part from the consumer, from the country's point of view, is people would compete. So if I've been 20 years in my town, I might charge $150 for an exam. If you're brand new out of school, you might charge $100. And there is some of that in optometry, because some of the things that you do are elective and insurance doesn't cover. There is competition. I always tell people there are two things in healthcare that work. It's because insurance primarily doesn't cover them: contact lenses and LASIK surgery. One is very cheap and one is very expensive. Contact lenses in my office were as cheap as Walmart, because nobody will come in there if you don't compete. You have to compete. So everybody's been forced to compete, for better or worse, with contact lenses. It's kept prices down, but people have sold more of them. You make up for maybe loss of profit by selling more of things. It's the same way with LASIK, which is much more expensive but not covered by insurance. The average person calls 4 different doctors before they go in. They want quality, but every one of them asks the price. But the average Medicare patient, in fact, any Medicare patient, never asks you the price. Why? It's set. So nobody shops based on price. And people say, oh, well, when you have a heart attack, you can't shop based on price. That's right. But 95% of what people do is actually elective. You could shop on price. So if we could free it up and have competition, we would drive prices down, but there'd be more freedom to you to decide what your charges are, and the government wouldn't be the final decider. The bottom line is there's an absence of it. There's not enough money for everything that people want up here. It's being driven primarily by entitlements: Medicare, Social Security, and Medicaid. What I think we need to do as a society is take care of those who can't take care of themselves. And so I think when you expand Medicaid to include people making $88,000 a year, you're doing a disservice to the guy making $8,000 a year or $11,000 a year, the person that's on dialysis, missing 2 legs, and is got 2200 vision from diabetic macular edema. That person we could take care of. But if you're going to take care of people who look like me, who hop out of their truck and put their handicap sticker up there, that's why we can't take care of everybody. So you need to have tough love. I'm not for no government programs. I'm for government programs that work for those who can't help themselves. If we did that, there would still be some people without insurance. There was 15% of our country that didn't have insurance. But instead of ruining it for the 85% of the country that had insurance, we should have tried to fix it for the 15% that don't. Who were the 15% that don't have insurance? A third of them are young, in their 20s, and make more than $50,000 a year. I'm not kidding you. A third of the 15% were not poor. Why didn't they buy insurance? Because it was too expensive. The real problem with insurance is the expense of it and the absence of competition. The problem isn't, you fix a third of the uninsured problem by fixing the price problem. A third of the 15% without insurance are eligible for Medicaid and hadn't applied, just because they haven't taken the time to go down and do it, and they'll just show up in the emergency room. So there were other ways to look at this without ruining it for the 85%. And I think the other thing that is unheralded is charity. I guarantee you probably half the people in this room or more have been involved with charity. We've either gone on mission trips to third world countries or have done charity in your communities. It's the same way among ophthalmologists and among all of the different professions. And charity is part of it. And I think it should be a valid part of how we try to help people. The bottom line is, though, that we cannot go on this course. The debt we have in our country is unsustainable if we do not address the debt. All of the things that we want to improve our profession or to make our lives better